Assalamu alaikum, Naveed Akbar, 2021 DVM 187, University of Veterinary and Animal Sciences. So I am here to present a case. The case is retention of placenta. At the introduction, I want to explain what is retention of placenta. Retention of placenta is failure to expel fetal membrane within 24 hours postpartum in a cattle. It is higher in dairy cows, where its case incidence is 5 to 15%, and lesser than in beef cattle, caused by failure of detachment between fetal cartilage and caruncles. Case history: 6-year-old Friesian cow, 35 kg, presented with inappetence, foul smelling discharge, 3-week calving history. Farmer used oxytocin once on the day. Vaccination and deworming are also okay. The risk factor. Risk factor includes abortion, dystocia, hypocalcemia, twin births, higher environmental temperature, age of the cow, induced parturition, placentitis, nutritional deficiencies are risk factor for ROP. Clinical exam. On clinical exam, we conclude that cow is bright, alert, responsive. TPR values are within the range. On key findings, there is a foul smelling brown discharge. Diagnosis: on the basis of history and clinical science. Clinical science, we conclude that it is a case of ROP, retention of placenta. ROP is economically important because it affects fertility when if not treated well. Early diagnosis prevent endometritis and toxemia that cause infertility. Treatment. The objective of treatment is to remove the retained placenta and prevent reproductive complications. For the procedure, we can do two types of treatment. One is uterine. In uterine treatment, we can lavage uterine by 0.9% in ACL, by IV, modified IV, when we pass through the vulva into the uterus. Continuous flushing removed brownish fetal discharge. Intrauterine antibiotic, oxytetracycline is also effective, with 20 mg per kg infusion, which is the final lavage. Systemic therapy, second one. Flumexine meglomine 1.1 mg per kg IM for 3-day, anti-inflammatory and anti-analgesic characteristic. Oxytetracycline 20 mg per kg IM, treating existing the infection and prevent secondary bacterial infection. Progression. Cow responded well the next day. No discharge from the vulva after treatment. Prognosis is good, but there is chances of reoccurrence. Fertility can be guarded if endometritis developed. Discussion. The discussion of case is diagnostic tests are unnecessary. Science clearly indicate ROP. Retention of placenta sometime in the uterus causing foul smelling discharge. When there is uncomplicated ROP that can cause systemic illness mildly. Manual removal is not recommended because it can cause trauma or infection. Oxytocin is only effective when there is detachment. Uterine lavage expelled cloud discharge, indicating membrane A partially detached earlier. If it is partially detached or earlier detached, then uterine lavage can expel the material. RP, ROP may lead to septic metritis. Systemic antibiotic is essential. When we use tetracycline, the milk of cow is safe after 4 days. Preventive strategies. For preventive strategies, we can use balanced diet, calcium, phosphorus, vitamin A, vitamin E, selenium, good postpartum management. Conclusion: ROP may not always impair reproduction, but if not treated, can cause infertility due to toxemia, death, and infertility also due to endometritis. Thank you.